The use of blood pumps, which is most common in the United States and across the world to support open heart surgery, involves essentially all the time the use of continuous flow pumps, and they're effective, but we know that there are downside risks or downside accompaniments to the use of these pumps while we're doing open heart surgery, and so in effect we create an injury to allow us to treat a condition. I think the current state of the art, as good as it is bad enough to justify looking for alternatives or iterative evolutionary, revolutionary improvements. If VentriFlo can do what it seems like VentriFlo can do, if it can deliver on the benefits that have been promised by the preliminary work that's been done so far, I absolutely think that it can change the standard of care. And standards of care can change literally overnight. VentriFlo is almost a snap-in. You take this out, you pop that in, now you've got a pump that's way better than the pump you had before. And people will pay large amounts of money for changes like the magnitude of those that we would project would be available if VentriFlo can do what it seems like it can. If you could reduce the length of time in the hospital, or the length of time on the ventilator, or the length of time in the intensive care unit, if you could reduce that by 5%, that's 5% reduction in hospital days, 5% reduction in exposure to risk, lives saved, complications averted, etc. That wouldn't just revolutionize heart surgery, it'd revolutionize health care. And you know, those are the kinds of things that obviously saving lives and saving misery and saving pain and saving suffering is great. Also saves money. So you're saving suffering and saving money at the same time. That's pretty revolutionary.